Raising children is stressful. That is no secret. But the Surgeon General issued an advisory on parental stress last week, calling it an urgent public health issue. Catherine Nim Emery is a licensed professional counselor with ThriveWorks in Cedar Park. She joins us this morning on Midday to talk about how parental stress affects our children. Good morning. Thank you so much for joining us. This is a big duh for those of us with children, right? So what did the Surgeon General's advisory tell us that we didn't already know?
Well, I think he was kind of getting around to it, right? That it is actually having long-term developmental effects, physiological effects. Chronic stress can be a problem.
No, it absolutely is. All right. So then there were some stats that they came out with as well, but basically we're all overwhelmed. So how can a parent or caregiver's mental health directly impact our children?
It's kind of what you intuitively already know, right? That although our children are so very resilient, and they are, when a parent is stressed, depressed, disconnected from the present moment and connecting with their child, children notice and they are affected by that. And that can be something as small as having a more rough day at school, all the way to neurological or developmental or physiological changes. So what we really need there is emotional strength, and as adults to model emotional strength. And when I say that, I don't mean putting on a mask or putting on a strong face and shoving that depression or that stress underneath the rug and hiding it from the kids. I mean facing it, taking responsibility for it, asking for help if you need it, and showing how you navigate that in healthy ways for the children. They watch, they pick up on it, right?
Oh, so emotional intelligence.
Yeah.
Something that's not taught in school, or when I was in school, right? So what should stressed out caregivers and parents do?
Well, number one is going to be gentle with yourself, to be self-compassionate, reduce that judgment.
Yeah.
Right, that we have for ourselves. You're doing your best. You're doing great. But number two is going to be showing that emotional strength, right? So if you're noticing that you are more stressed, disconnected, let's say you feel like you're just floating through surviving, you need to go in and get some help, either from community or from a professional, right? And it's not a weakness to ask for help. It's a strength.
It's a strength. So recognizing signs, can you name some of the signs before we get to the point of exploding on our kids?
Yeah, a lot of it's body-based. So starting to pay attention to what your body signals are. Now, most of us are running through our days disconnected from our bodies, so that can be a little difficult. But noticing if you are zoning out more, if you are getting feedback from others about what's going on. But it's a lot of like body breathing, like, am I tight? Am I tense? I have neck pain. Am I ignoring those things? Okay, well then that might be your sign.
No, there you go. And so what can others do to help caregivers and parents?
A lot of it's community and getting involved in community and making the community a safe, supportive, non-judgmental space for parents to come when they're struggling. A lot of what the Surgeon General said was really good stuff about policies and those changes, but on a personal level, like a you and I level, it's going to be making sure that we know our teachers, our neighbors. Do you know the parents of your children's friends, right? Are you getting involved, getting out there, getting connected? We are so isolated and alone right now. Getting back into community is priority number one.
Yeah, pandemic didn't help anything at all, right? All right, so Catherine Nim Emery with ThriveWorks in Cedar Park, thank you so much for joining us here on KVUE News Midday.